13 disabilities. Autism is a developmental disability that affects verbal and nonverbal communication, as well as social interaction, affects a child's educational performance, and usually the child with these conditions engage in repetitive activities and offer resistance to environmental changes. Deaf or hard of hearing. They have to meet the criteria for deafness. Hearing impairment is severe. The child is impaired in processing linguistic information and affect the child's educational performance. The licensed medical doctor has to give documentation. Deaf blindness is a concomitant hearing visual impairments. It's a combination that causes severe communication, developmental, and educational needs. It cannot be accommodated in special education programs for children with deafness or children with blindness. And it has to be documented the hearing and visual losses and a medical diagnosis as well. Emotional disturbance. It has the inability to learn, or students present the inability to learn, inability to build interpersonal relationships, inappropriate behavior, unhappiness or depression, develop physical symptoms or fears associated with personal or school problems, and includes also schizophrenia. Intellectual disability is a sub-average general intellectual functioning. It has deficits in adaptive behavior and affects educational performance. The overall test score is at least 2 standard deviations below the mean, and there are deficits in 2 areas of adaptive behavior like communication, self-care, home living, social interpersonal skills, use of community resources, self-direction, functional academic skills, work, leisure, health, and safety. Multiple disability has intellectual disability and blindness, or intellectual disability and orthopedic impairment. Is a disability that will continue indefinitely and may cause severely impaired in psychomotor skills, self-care skills, communication, social and emotional, and cognition. Non-categorical early childhood usually is between ages of 3 and 5 years old. Child with this non-categorical early childhood has or intellectual disability or emotional disturbance, specific learning disability, or autism. Orthopedic impairment is a severe orthopedic impairment that affects educational performance and is caused by a congenital anomaly and disease. We find several like poliomyelitis, tuberculosis, cerebral palsy, amputation, fractures, and we need the documentation from a licensed physician. Other health impairment meet the criteria for other health impairment has to be one of the criteria, and chronic or acute health problems is another one, affects educational performance. It's present limited strength, vitality, or alertness in the child, and it could be, for example, asthma, diabetes, leukemia, epilepsy, ADD or ADHD, lead poisoning, hemophilia, or heart condition, and we also need documentation from a licensed physician. Specific learning disability. Not sufficient progress to meet age or state-approved grade level standards. Exhibits a pattern of strengths and weakness in performance or achievement or both. Does not achieve adequate in oral expression, listening, writing, basic reading skills, fluency on and calculation. Include conditions such as perceptual disabilities, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. Speech impairment. Communication disorder like stuttering, impaired articulation, language impairment, voice impairment, and affects educational performance. We need information from a licensed speech or language pathologist. Traumatic brain injury is caused by an external physical force. It can cause a total or partial functional disability, psychosocial impairment, or both. Open or closed head injuries, impairments in one or more areas like cognition, language, memory, attention, problem solving, speech, and affects educational performance. We need information from a licensed physician. Visual impairment, including blindness, means an impairment in vision, affects educational performance, includes both partial sight and blindness, and it has to be confirmed by a multidisciplinary team, the which will uh, write informs about this child. Special Education Initial Referral Timeline. Referral for initial evaluation will first the campus request or parent request verbal or written to a local education agency, director of a special education or district administrative employee, and no later than the 15th school day after the day the district received a written parental request. Then it has to be the notice of action. We have to provide parents with prior written notice for evaluation, provide the parents with notice, procedural safeguard, an opportunity to provide consent to evaluate, or provide parent with prior written notice of refusal to evaluate and notice of procedural safeguards. Then no later than the 45th school day following the date on which the district received written parental consent, we will have the full individual initial evaluation completed with written report, which is the comprehensive evaluation of all components is conducted to determine 1. The child's disability according to eligibility criteria, and 2. Educational needs of the child. Then within 30 days of written report, the R committee must determine eligibility. Notice of admission, review, and dismissal are committee meeting. We have to provide parent with the parent's guide to the admission review and dismissal process at any time prior to the initial R committee meeting. We have to also provide parents with at least 5 school days notice of initial R committee meeting, and we have to meeting should be held at a mutually agreeable time and place. Plus, initial committee meeting has to establish its eligibility is determined by our committee. An individualized educational program, if appropriate, is developed. Provide parents with prior written notice outlining decisions made and actions to be taken. Provide parents with an opportunity to provide consent for initial placement. Special Education Full and Individual Evaluation FIIE Timeline. The school district received written consent for the FIIE signed by the student's parent or legal guardian, including students under 5 years of age by September 1st and not enrolled in public charter school and students enrolled in a private or homeschooling setting. At least 45 school days prior to the last day of instruction, the written report of the evaluation must be completed no later than the 45th day of following the day written consent was received. The admission review and dismissal art committee must determine initial eligibility within 30 days from the date the evaluation report is completed. If the 30th day falls during the summer, the art committee has until the first day of classes to finalize decisions related to eligibility, IEP, and placement. If a student has been absent 3 or more days from school during that period, then the written report of the evaluation must be completed no later than 45 plus the number of the absent school days following the day written consent was received. At least 35 but less 45 school days before the last day of instruction. The written report of the evaluation must be completed and provided to the parent or legal guardian no later than June 30 of that year. The art committee must meet no later than the 15th school day of the following school year to consider evaluation. If a student has been absent 3 or more days from school during that period, then written report of the evaluation must be completed no later than 45 plus the number of the absent school days following the day written consent was received. The art committee must determine initial eligibility within 30 calendar days from the day the evaluation report is completed. If a ferié day falls during the summer, the art committee has until the first day of classes to finalize decisions related to eligibility, IP, and placement. Less than 35 school days before the last instructional day of the school year, the written report of the evaluation must be completed no later than the 45th school day following the day written consent received into the following school year. The art committee must determine initial eligibility within 30 calendar days from the day the evaluation report is completed. If the 30 day falls during the summer, the art committee has until the first day of classes to finalize decisions related to eligibility IB placement. We use the website from Child Find of DEA to organize all this information. Please remember to subscribe to my channel, to hit the bell, and to like the video.